Hello everyone, I welcome you all to this fourth episode of Nursing Officer Exam Preparation. Question number 1. The term flight of ideas refer to option A. Use of rhyming words, option B. Repetition of word heard, option C. New words invented by the patient, option D. Patterns of rapid transition from one topic to another topic. So the correct option here is option D, which is rapid transition from one topic to another topic. It's termed as flight of ideas. Use of rhyming words is called clang association. The term is called clang association. Repetition of word heard is the term is used echolalia. New words invented by patient, the term is known as neologism. Flight of ideas. Question number 2. A type of chart which is meant for representing organization or hierarchy of an administration is called option A. Pictorial chart, option B. Flow chart, option C. Tabulation chart, option D. Narrative chart. Correct option here is option B, which is flow chart. Flow chart is used to represent the organization or the hierarchy of the administration. It goes like from top to the bottom of the organization. What is pictorial chart? Pictorial chart, also known as pictogram. Pictogram. It is use of picture in charts. And tabulation, tabulation is like table. It represents the systemic and logical representation of this numeric data in columns and in rows. So it's basically a table chart. And narrative, it came from narrate. It helps in storytelling. This type of charts helps in storytelling. Question number 3. The following are the clinical features of rickets except option A. Serophthalmia, option B. Pectus carinatum, option C. Harrison sulcus, option D. Craniotapes. The correct option here is option A. Serophthalmia. Here the question asks, the following are the clinical features except. So serophthalmia is the correct answer. Serophthalmia is a disease which causes dryness to the eyes due to deficiency of vitamin A. And what is pectus carinatum? It also called as pigeon chest. It's also clinical features of rickets. Harrison sulcus, it's indentation of ribs. And craniotapes is the softening of skull bones. These three are all the clinical features of rickets. And this is what pigeon chest looks like, also called as pectus carinatum, and this is Harrison's sulcus, indentation of the ribs. Question number 4. The transvaginal aspiration of peritoneal fluids from the pouch of the glass is called option A. Hysterosalpingography, option B. Coldosynthesis, option C. Abdominosynthesis, option D. Amniocentesis. Correct option here is option B, which is coldosynthesis. It is a procedure in which the peritoneal fluids is aspirated from the posterior pelvic or from the pouch of the glass, also called the sac pouch of the glass, through the posterior vaginal vernix or transvaginal. And option C, abdominosynthesis, also called as abdominal paracentesis. It is aspiration of peritoneal fluids through abdomen. amniocentesis, it is the aspiration of amniotic fluids. And hysterosalpingography is the X-ray procedure, is the X-ray used to view the inside of uterus, and fallopian tube. Question number 5. The study of human interactions and interrelations, their conditions and consequences are known as option A, psychology, option B, anthropology, option C, sociology, option D, paleontology. Psychology is the scientific study of mind and behavior. Anthropology is scientific study of humanity concerned with human behavior, human biology, culture, societies, and linguistic in both present and the past. And what is sociology? It is social science that focus on society and their interaction with each other. And then paleontology is the scientific study of life of the geologic past that involve analysis of plants and animal fossils. So the correct option here is option C, which is sociology. The part of the brain which is referred as the functional gateway for cerebral cortex is option A, cerebellum, option B, brainstem, option C, medulla oblongata, option D, thalamus. Correct option here is option D, which is thalamus. Thalamus is known as the gateway to the mind. Question number 7. The pyloric canal is related to option A, spleen, option B, stomach, option C, spinal cord, option D, scrotum. Correct option here is option B, which is stomach. Question number 8. A permissive style of leadership in which the leader leaves all the decision making and responsibility to the group member is called option A, autocratic style leadership, option B, democratic style leadership, option C, laissez-faire leadership, option D, participation style leadership. Autocratic style leadership means the leader make all the decision. It is the leader who make all the decision with no inputs from others. What is democratic? Democratic is also called as the participative style of leadership. Here, what happened? The leader involve other members of the groups in decision making process. And what is laissez-faire leadership? Here, the leader does not interfere. The leader does not interfere in the decision making of the group. He'll leave all the responsibility to the group members. So the correct option here is option C, which is laissez-faire leadership. Question number 9. A teaching method which defines an accurate representative of realistic situation is called option A, self-instructional module, option B, seminar, option C, simulation, option D, symposium. Option A, self-instructional module is a way of learning. It's a way of learning in which the learner learn at his own pace. Way of learning at own pace, or learn by himself or herself. Seminar is a type of meeting for discussion on a particular topic by teacher or speaker. Simulation is the imitation of a realistic situation or process. Symposium is a type of meeting for discussion on a particular subject by several speakers and is done before the audience. The correct option here is option C, simulation. Question number 10. What does the inner triangle in the symbol of under 5 clinics denotes? Option A, health education. Option B, crude monitoring. Option C, family planning. Option D, preventive care. Correct option here is option C, which is family planning. And this is the symbol of under 5 clinics. And here is the inner triangle, which in the question asks what does the inner triangle denotes? It denotes the family planning. Question number 11. Couvelaire uterus is considered to be a severe form of option A, abruptio placenta, option B, placenta previa, option C, placenta accreta, option D, placenta increta. And what is this couvelaire uterus? It is also known as uteroplacental apoplexy. It is a life-threatening condition. It is a severe form of abruptio placenta. So the correct option here is option A, which is abruptio placenta. Question number 12. Guthrie blood test is recommended to diagnose option A, galactosemia, option B, homocystinuria, option C, phenylketonuria, option D, alkaptonuria. And what is this Guthrie blood test? It is also known as PKU for phenylketonuria. PKU test. It is a diagnostic tool to diagnose infant for phenylketonuria. So the correct option here is option C, which is phenylketonuria. Guthrie test or Guthrie blood test is recommended to diagnose phenylketonuria.